Okay, so also. Okay. All right. So thank you for joining me today. I've got the pleasure of speaking to Dr. Victoria Sampson, who's in London, in the United Kingdom. We're going to talk all about the oral microbiome today, which is a really interesting topic, one that I'm really fascinated about, one that opened up a journey for me to learn more about the oral systemic connection, but one that I think that is becoming more and more prevalent in clinical practice in how we understand presentations in the mouth and then connections to what we see in the rest of the body. Dr. Sampson, thank you so much for joining me.
Thank you so much for having me. It's a great pleasure to finally meet you.
Yeah, you too. Absolutely. We've been discussing a little bit about some of this work that's kind of disseminating somewhat slowly through the dental profession, that bacteria in the mouth are very influential on the rest of the body. But the evidence has been around for some time, hasn't it, that there are big connections between oral disease and what we experience systemically. Take us back a little bit to maybe your first experiences, opening your mind to how influential oral bacteria and oral diseases are to the rest of the body.
Yeah, so it actually for me all started during COVID. So before that, I would say I was a pretty standard, normal dentist. And then when COVID happened, we weren't able to work for a couple of months. And I was obviously quite upset because, I felt like actually dentistry was quite an integral part of general health, and it should have been one of the core services that was kept open. And if anyone knows me, you know that I don't really sit still for very long. So I decided to start doing research. And my research was on how the mouth was connected to COVID. And I had this idea that if you had gum disease or poor oral health or an imbalanced oral microbiome, this would predispose you to worse COVID complications. So during that time, all research was open access. So I had a field day just, looking at every single research possible. And I wrote a paper on it where I said that, gum disease would increase your risk of COVID complications because both diseases are going through kind of the same pathways in terms of inflammation, in terms of super infections, and they both have quite similar risk factors. So people, diabetes, heart disease, all of this, they were very similar. And then that ended with a lot of universities getting very interested. And it started a big research kind of trial or program in the UK where we were doing microbiome testing on COVID sufferers in hospitals. And the only way we could see what was going on in a patient's mouth was through their oral microbiome, because obviously we couldn't see them face to face. And lo and behold, it was all true. And actually, patients who had really dysbiotic oral microbiomes or had very bad gum disease were at a much higher risk of COVID complications and being in ICU. So that kind of really opened my eyes, where I was like, oh my God, like this is really important, and was one of the reasons that actually dentists were able to go back into working during COVID, because people realized that we do a lot more than just drilling and filling and cleaning. It's a lot more. And then after that, I started working with more salivary diagnostics, looking at the saliva as more of a diagnostic medium than just spit, and kind of seeing, working with patients. Particularly at the beginning, it was rheumatoid arthritis, and seeing how treating patients with rheumatoid arthritis and treating their gum disease actually improved their rheumatoid arthritis symptoms.
It's a fascinating connection, and the link between rheumatoid arthritis in particular has been well published, in connection to periodontal disease. And there's a host of conditions, isn't there, that that do link into risk alongside periodontal disease. Describe to us a little bit, because these links have been around in the research for some time, and you learn them as a dental student that, hey, gum disease in particular is at risk, higher risk for certain cardiovascular diseases, type 2 diabetes, and rheumatoid arthritis and so forth, the one that I think is really interesting is autoimmune conditions as well, because it really, you have this cross classification of gum disease and autoimmune. I think there's something there that suggests that, gum disease is an autoimmune condition. But tell us about, some of the classic kind of way that we describe this link between gum disease and these systemic conditions. And so there's, this shared risk, but like, what does the literature tell us about, increase how high your risk is if you do have serious gum disease of certain conditions?
I think the main connection between systemic disease and gum disease in particular is through two kind of connections. One is low-grade chronic inflammation, and that's the idea where you have periodontal disease or gum disease, and there's high levels of bacteria, and those bacteria are releasing lots of inflammation. And these inflammatory markers are causing localized inflammation, which is what we see when you've got bleeding gums and you've got your gum disease. But actually, all of that inflammation is also traveling elsewhere in the body. And what's interesting is that with low-grade chronic inflammation, it's not enough that someone might, go to their doctor and have a problem because it's low grade. It's not a huge, massive amount of inflammation. But if a patient is suffering from that sort of inflammation for many, many years, then actually it can really negatively impact their general health. And it can add fire to the petrol, what I say to patients is, imagine if you have another inflammatory condition, like you've got your rheumatoid arthritis, and then you've got even more inflammation just being added and piled on top constantly for years. That's going to obviously make your arthritis much, much worse. So that's kind of your first mechanism. And the second is actually just bacteria. And I think some people forget that gum disease is essentially a bacterial infection. And if you had a finger that was constantly bleeding, or there was pus oozing out of your finger, you'd probably be slightly concerned. But when people have, blood and pus coming out of their tooth, they're like, oh, it's okay. But actually, that's a huge negative effect on the rest of your body.
Yeah, the perception of that, chronic low grade and sometimes, more serious inflammation in the mouth, doesn't affect the rest of the body, is somewhat, it's somewhat prevalent in society, isn't it? That we don't really kind of consider bleeding gums as something that's really serious. But as you described, it is, a significant aspect of our physiology that, we are potentially forgetting. Tell us a little bit about your kind of maybe first approaches, or how you, maybe used to treat gum disease, and what you saw in patients in terms of outcomes, earlier, when maybe you weren't looking so much at this oral microbiome view of the mouth.
So I think traditionally, I mean, obviously, I don't know what you guys do over in Australia, but traditionally for us, patients got gum disease. We're probably doing some deep cleaning for them. We might do it over a couple of appointments. We might, put them on an antimicrobial mouthwash and a toothpaste, and we tell them to come back 3 months later. And I think that's the kind of conventional, traditional way. In my opinion, it's too much of a blanket approach for every person, and every single person who suffers from periodontal disease has different causes of that disease, and therefore different needs from their treatment. So we know that periodontal disease is not just caused by bacteria. It's actually how your body responds to that bacteria. And your body's response to that bacteria is dictated by your general health, by your genetic predisposition to inflammation, to so many different things. And so now my approach is very different. So I try and take a much more personalized approach for each patient. So that starts with, yes, your microbiome test. We test a lot of patients' saliva for their bacteria, and therefore we know exactly which bacteria are causing that gum disease. Then we can actually look at inflammatory markers and see if there's any sort of inflammation, which is also impacting that. We can look at their base pair mutation, so we can even look at their genetics and see whether or not that patient is more predisposed to gum disease. And one of the biggest problems I kept on getting a long time ago was that you can have two patients, and one brushes their teeth absolutely fantastically, and they've never smoked a cigarette in their life, and they're so healthy, but they have the worst gum disease ever. And those types of patients are really difficult to treat because what do you say to them? Like, brush better? Well, they are. And that's a patient whose immune response in their body needs a little bit more support and help. And then you'll have another patient who smokes 20 cigarettes a day, brushes once a week and doesn't really do much. And yes, their mouth's a bit dirty, but they don't have any gum disease. And that's where you start seeing that it's not just bacteria, it's how the body's responding to it. And you need to be treating patients differently for that.
Yeah, I really like that explanation that it's the patient's personal response to that bacteria, because as we'll talk about the testing specifically and all the different bacteria and everything, but as you say, people do respond differently to these kind of these kind of presentations, and there are some presentations that absolutely you would not expect from a maybe a young late 30s to early 40s mother or so forth, that you wouldn't expect any kind of periodontal presentation. But then when you dig a bit deeper, you find that there's these risks that do obviously have a big impact on how their body is managing their inflammatory status, and then the mouth is presenting this, and it's kind of like this hidden window into a person's health.
Yeah.
It's interesting that you say that, and I think would you say that that's something, I mean, you alluded to it, that is missing from maybe a conventional dental check?
Massively. I think we opened our clinic about 9 months ago, and it was never meant to be, perio focused and we're only doing gum disease. But what we started to attract were patients who had been seen by multiple dentists, who'd had multiple rounds of treatment for gum disease. And by the time they came to see us, they were kind of a bit frustrated, disheartened, upset, because they didn't know what was wrong. They felt like it was their fault, and they didn't know how to sort that and treat it. And so by actually seeing that, there are other things that are affecting it. It's not just you're not brushing well enough and you need to TP a little bit more and use more floss. There's a lot more to it. It kind of, I think, motivates patients and makes them feel like, okay, you know what, sometimes this isn't completely my fault. And some of us, unfortunately, have a slight disadvantage from birth. And we need to counterbalance that by maybe even taking a few more supplements, maybe changing the way we eat. It's not just about brushing better. There's so much more to improving your oral health and obviously your general health as a result.
Yeah, I really like that description too. Is that some people that they really have gone through a lot of effort to maintain what they've been told is a very serious condition, and they've been referred to. I think you're referring to maybe people that have been treated by a
Yeah.
periodontist for some
Yeah.
years. Yeah, yep.
Yeah.
So I mean, why don't we explain that just so people kind of get a little bit of a an overview of how general periodontal disease is kind of identified in the general practice, and then maybe managed by the specialist, and how that works a little bit between practitioners.
So again, in the UK, I don't know about you guys, but for us, it would mainly be that you'd come in, let's say for your general dental check. We do something where we basically probe your gums, so we see how far a probe can go down your gums. And ideally, your gums should be so tight, like a turtleneck on your tooth, that the probe can't go down there. In patients who have gum disease, that probe can go a little bit deeper than that. And how deep it goes kind of dictates how bad the gum disease is. So less than 3 millimeters is like, that's good. When we're going into your fours, five, sixes, not so great. You definitely got gum disease. And when you're past that 6 millimeters, that's pretty bad gum disease going on. So that's one marker. Then we look at bleeding. So that's why a lot of people don't like coming to the dentist. Is always like, oh, they always poke my gums. The reason is because a lot of the time we're seeing if there is some bleeding on probing, and bleeding is a sign of inflammation. And so that's another way. And then obviously we might be taking some x-rays too. We obviously will be listening to your concerns. So you might say, I have bad breath. My teeth feel wobbly. My gums bleed every time I brush. All of these are kind of signs of someone who's suffering from gum disease. And then based on that, most of the time, if you have been diagnosed with gum disease, for me, what we would do is we would do like what we call a full mouth disinfection. So over a course of a few treatments, we would numb up different parts of your mouth and go super deep and do a really deep clean there to get rid of all that bacteria that is underneath the gums, which is causing that inflammation. Then we might tell you to, use certain things at home because it's a 50-50 job. So I can do a fantastic job, but if you're not going to maintain it at home, it's not going to do well at all. And then we would maybe see you a couple of months later and see if your gums have healed well after that.
Yeah, and for some people maybe that have advanced disease, that they have this under a specialist, don't they? And they kind of get into this kind of recall pattern between the general practitioner and the specialist. And is that where you were picking up maybe some of the patients that have hadn't found answers or hadn't had progression in their condition?
Yeah. So, so let's say you've done all this deep cleaning, and then a few months later you come back and we do all the same things. So we're poking, we're probing, we're doing all that, and let's say there's not really very much improvement. You might see a periodontist and do the same thing again. Sometimes they'll prescribe antibiotics, and in some cases that's absolutely fantastic, and your gums have healed, and the gum disease has been arrested, and you can live your life, but constantly maintain it. And for some patients, unfortunately, they have to go over and over and over again, and they keep on having, areas where they need to do more deep cleaning. And that's where I think some patients get a little bit disheartened, because one of the biggest issues I think with gum disease and patient education is that it's very difficult to explain to patients what gum disease is. And I'm probably doing a terrible job right now, but I'm trying. But it's very difficult to explain it to a patient, what causes it, and how to treat it, because me sitting there saying like probing depths and bleeding on probing and all of this, it's very difficult for people to understand. And that's why I then started using salivary diagnostics and using microbiome testing and inflammatory markers, because everyone can understand numbers and they can see when something's too high and something's too low.
No, that's right. Yeah, I want to dive into all the diagnostic tests, but I thought it was useful to get that confusion, and sometimes that place that patients sometimes get stuck in, with they've been told they have this condition in their mouth, right? Their gums are bleeding, their bone is shrinking away. They're somewhat terrified about this or concerned, but the kind of progress forward is a little bit vague, isn't it? Because the clinical kind of prognosis is, well, we can't get rid of this, it's there, but we can try to halt it. And so I think you described this situation where a patient is feeling a little bit maybe stuck or hopeless quite well, and it's a great point. Is that it's a hard condition to explain, and maybe the problem there is that maybe we haven't understood it all ourselves that well. And I think that's what you've probably found, is that what we can find from this further testing and this deeper understanding of the ecology and the sociology happening within the bacteria is a whole part of this physiological system. So it's a good point to kind of bring up, I think, for people out there that have gum disease, that a lot of people are kind of stuck in this cycle a little bit, and that there are solutions out there. So let's dive into a little bit about what the oral microbiome is, because we've been talking about bacteria in the mouth for some time. This isn't a new area in dentistry. Bacteria have been measured in dentistry for some time, but during COVID, you kind of dived into this whole area of imbalance and certain diagnostic systems for what's happening in the mouth. Tell us a little bit about what we do classically within periodontal disease, measuring bacteria, and then where this new area of measuring the oral microbiome is taking us. And it really is a fascinating frontier of testing for medicine.
Yeah, so it's a super exciting time, and I think that there's a whole new interest and towards the oral microbiome. And so, for example, like so many newspapers are publishing articles on it, and it was the front page of the New Scientist, and which is amazing. But you are right. This is not a new invention or phenomenon. We've known about this, and it kind of all started um, in the 1700s, and that's where we saw that oral bacteria existed. Um, there was a lovely man called Anthony van Leeuwenhoek, and he, in the 1700s, didn't brush his teeth for a couple of days, and he saw this white film collecting on his teeth, and he scraped that off, and he put it under a microscope, and he was the first man to draw some of the oral bacteria that we now know. And then you fast forward, a couple of centuries, and we started to see that actually there were certain bacteria in the mouth that were causative of disease. And the most important one at that time was decay. So they did a lot of research to show that there was a strong connection between strep mutans, which is an oral bacteria, which was able to actually cause decay in teeth. And they injected strep mutans into mice, and they were able to cause decay in mice that never had decay in their lives. So that's when we saw that it's not just that it's not a correlation, it's causal. And then we kind of had this idea that it's called the non-specific plaque hypothesis, and this was the idea that all bacteria causes disease, and we must get rid of all bacteria to get rid of all disease, which is we now know is not correct. And so, but at that time, that's where a lot of your strong antimicrobial mouthwashes came out, the obsession with antibiotics. It was just kill, 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 get rid of all the bacteria. And then much more kind of in the mid 1900s, we're now seeing that actually some bacteria are great for the mouth. Some bacteria are terrible for the mouth. And that's where the idea of the microbiome has really cemented. And this is the idea that you've got this beautiful ecosystem of, about 2 billion bacteria in your mouth, which cover 700 different species. And all of these bacteria are kind of working with each other. And you've got good bacteria, terrible bacteria, you've got, all sorts. And they actually work in this ecosystem and they keep each other in place. So it's all about balance. It's not about having only good bacteria and no bad bacteria. It's about having a nice balance of all of it and a good diversity. And that's where I would say in the last 5 to 10 years, we are starting to see the kind of interest in oral microbiome testing and looking at that balance and seeing, not to kill everything, but maybe just kill a few bad bacteria, replace them with some good bacteria, so probiotics, trying to modify things. And this is not just oral microbiome, but same with gut microbiome and vaginal microbiome. And we now know it's balance really that we want.
And there have been quite well published links on between certain oral bacteria and systemic conditions and so forth too, where we can track certain bacteria to certain organs even. What have you seen in the literature that has been quite compelling in terms of where oral bacteria is a powerful diagnostic tool for systemic risks?
So I think like you said, this research has been around for a long time, but a lot of people were very apprehensive and a bit like they were kind of like, oh, there's no real evidence to say that this bacteria causes this disease, and it's more correlation. And they've been saying this for decades and decades and decades, and and then now in the last 5 years, you're like, come on, like how much research do we need for you guys to just maybe think that like I'm talking hundreds of thousands of papers which are saying that there are certain bacteria which cause certain diseases or are found in certain diseases. The ones which are most compelling for me are infertility. So I find that really interesting. So there's a few specific bacteria, particularly one called Fusobacterium nucleatum, and that is found in women who suffer from preterm birth or their babies have low birth weight. And they find that Fusobacterium nucleatum, which is found in the mouth, is actually able to travel through the placenta and cause problems during childbirth. And they did a really cool study in Somalia, I think, and they basically saw that there's a very high chance of low birth weight and preterm birth. And so they split up a large group of women into two, and half the women were given sugar-free gum to chew regularly, and they were given the dental support that they needed, and the other half were kind of left as they are. And what they found was that the women who were chewing the gum and having their dental treatment had a significant reduction in low birth weight and preterm birth when it came to giving birth. So, I mean, I thought that was amazing because it's such an easy fix. You know, it's a cheap and easy thing that you can do, and imagine having such an impact on someone's life. That's a big one in Alzheimer's as well. So with Alzheimer's, they found there's a lot of research and kind of excitement over this specific bacteria, which is only found in the mouth, called Porphyromonas gingivalis. And this is quite a bad bacteria. And they have found that there are specific strains of Porphyromonas gingivalis which release an enzyme called a gingipane. And these enzymes can travel up to the brain and cause degradation of brain cells and neurons. And they found that in, I think, 97% of patients who suffered from some form of Alzheimer's or dementia, that they had gingipanes in their cerebrospinal fluid. So again, you're starting to see that there's huge connections, and it makes sense, kind of. I mean, the mouth's here, the brain's there. It's not that far to travel, you know.
No, it's not. And yeah, the general kind of risks, as you kind of talk about with gum disease, and then all of the risks of dementia really do line up to. It's a really fascinating link. If we just start to kind of see, you know, periodontal disease as a risk for the rest of the body, you know, things like vitamin D deficiency, you know, sleep apnea, you know, certain even metals and so forth, you know, that they're tracking both into dementia and may impact periodontal disease as well. But it's a really powerful you know, research link that, as you say, you know, the low birth weight one, you know, that's been taught in dental schools for decades now. And you know, that is such a powerful, you know, medical you know, tool that we could use to, as you say, prevent so many issues, you know, from a very early age, you know, through pregnancy. So it's really important, I think, that you know, it's showing how impactful this kind of work can be. And those links, you know, they go to things like, you know, cardiovascular diseases and, you know, type 2 diabetes that affects billions of people. So all of these things are, you know, very important for people to understand. So you describe it very well. Okay, let's dive into some of the bacteria and tests that we're doing. Do you want to take us back to what you were doing or what you found in the COVID literature in terms of specific bacteria, and what kind of tests you were conducting then in terms of risks for outcomes in with COVID, the COVID condition?
So we were pretty simple at that time. We literally were just looking at about like 30 different oral bacteria through the saliva, and then we're also looking at a selection of inflammatory markers called cytokines. And so we were collecting saliva swabs from patients in 3 different risk categories. So ones who were in ICU, who were incubated. So there were our very severe kind of COVID sufferers. Then we had ones who were hospitalized, but they were not being incubated. And then we had ones who were just at home isolated. So we had these 3 levels, and then we were collecting saliva from them every day for the duration of their disease. And then we were analyzing that. And so that's where we were able to see high levels of certain bacteria. And usually you would have done, you know, a checkup on them, you would have looked at their gums, but we couldn't do that. And it really opened my eyes, though, to how you can have a snapshot of someone's oral health just through some saliva. So that's where it all started. And then that led to me helping create a commercially available microbiome test, which then patients and dentists could use to actually start to understand their mouths a little bit better.
And so what kind of testing, what kind of bacteria are you now measuring in the mouth? And you tell us about your oral microbiome test.
So yeah, now things have developed a bit more. And so when we were just doing the microbiome testing, I was like, this is awesome. But one of the problems, which I mentioned at the beginning of this talk, was that you can have these two patients who have, pretty much the same microbiome. They can have very similar bacteria present in their mouths, but their body is responding very differently to that bacteria. So that's when I started saying, okay, we can't just look at bacteria. We need to look at, yes, inflammatory markers. And that's more of maybe a way to measure how much inflammation is happening. Then you can start looking at genetics. So we also we look at certain base pair mutations in genes. And we know that some people are genetically more predisposed to inflammation than other people. And those are, I'm one, for example. I've done the test. And I don't have gum disease. But what it means, though, is that if I was to not brush so well, slip up a little bit, not take very good care of myself, I would be at a much higher chance of getting gum disease than maybe, someone else down the road. It also is, I'm also that type of person who I, I catch colds quite quickly. I respond very aggressively to sicknesses. And so this is like how my genetics might kind of show as a person. So, for example, when I had COVID, I had really bad COVID. Like, I'm young, I'm healthy, everything, but I responded quite aggressively to it. And that's because I think I'm genetically a lot more predisposed to inflammation than maybe someone else. So yeah, we have the genetic side, and then we also look at certain enzymes as well. So one in particular is collagen breakdown. So it's called AMMP8, and it's an enzyme that's broken down when collagen is broken down. And there are lots of different types of collagen in your body, but there's one specific collagen that makes your gums. And so one of the issues with gum disease is that we only are able to diagnose it once it's too late. Once you start seeing symptoms in the mouth, it's already been happening for at least 6 months to a year before. So by looking at collagen breakdown, we can actually start to see whether a patient has this collagen breakdown early before we start seeing symptoms in their mouth.
Yeah, and exactly an important marker as to, because we're measuring, probing depths and so forth. But as you say, that the regaining this tissue or regaining lost tissue is difficult. So having early markers is incredibly important. And all of this is somewhat suggesting that there is there's a diagnostic system here within the mouth that that you've done, taken a lot of great steps to kind of develop, that really can be an interface for many other aspects of potentially referral to other practitioners, multidisciplinary approaches and so forth. Tell us a little bit how this kind of work has changed your practice as such.
So, like you were saying with the multidisciplinary approach, I now work very, very closely with doctors, functional practitioners, nutritionists, and they often will refer patients to me because they now know that me sorting out the mouth of their patient is going to improve, or it's going to help them do their job and will improve the health of their patient generally. So that's number one. And then the other way round happens a lot as well. So, for example, if someone has really high collagen breakdown and they have genetic predisposition to inflammation, and it's, they're just very like all over the place, kind of, there's just a lot going on with them. Yes, I can treat their gum disease and make their mouth look beautiful, but I think there's bigger problems hidden there. And so that's where I might make a referral to a doctor and say, look, this patient, I think, has something else going on. You might want to do full blood test on them. You might want to check their general inflammatory markers, their CRP, their all of that. Sometimes we do vitamin tests as well, so we'll look for any nutritional deficiencies. As you said, vitamin D is a very strong. Vitamin D deficiency is a very big risk factor for gum disease, and so it's a lot of back and forth now between doctors, dentists, nutritionists, and trying to create a much more holistic approach for a patient where, if they're having, for example, if a patient has heart problems and they come and see me, their cardiologist should know that they're seeing me, I think. And so we work in a much more, holistic approach.
And so what have you found? I mean, because you mentioned that patients will come to you with persistent gum disease. What have you found that you've uncovered, frequently, or, maybe more commonly with people that have been stuck in this kind of this difficult presentation of gum disease where it's continuing to persist, even though they're having treatment? What kind of conditions are popping up for them?
Nutritional deficiencies is one for sure. So a lot of them have vitamin D deficiencies. Um, there's been a few who have had kind of gut issues, which were, they always knew they had gut issues. They'd be like, yeah, I'm bloated all the time, and I'm, you know, like flatulent and all of these things, but they never did anything about it. And then in our microbiome test, we're able to see if someone might have gut issues. I can't tell you what the issue is, but I can tell you that there are bacteria in the mouth that shouldn't be there, and you have maybe very acidic saliva. There's something not right there. So I've often referred them to maybe do a gut microbiome test. And then we work together, the nutritionist and I, and they'll do the gut, I'll do the oral microbiome, and we meet in the middle. And the beauty of that is that it's all an extension of each other. So there's no point, in my opinion, to have a really, really balanced gut microbiome if your mouth's an absolute mess. And if you, vice versa, if your mouth is beautiful, but your gut is really, really imbalanced, then you'll never fully be healthy. So we've done quite a few referrals there and been able to find patients who have all sorts of colitis or Crohn's disease, and they didn't really know that they had those things. Um, what else? I think those are, oh, and another one actually that has come up a lot recently since COVID is something called mast cell activation. And so it's patients who post COVID became very hyper-inflammatory. They often would start being allergic to things that they were never allergic to. They would get rashes randomly, very, very inflammatory. Everything is just super inflammatory. And we were seeing super high levels in their mouth of inflammatory markers. Their collagen breakdown was through the roof. And so often we would send them for blood tests and to see it, one of our doctors, and we would actually be able to see that these patients were going through a lot systemically, just through their mouth.
Such a powerful diagnostic tool, isn't it? And the just so people understand, so what set of bacteria? So take us through some of the specific bacteria that you're testing, and what are some of the outcomes that you see when you see high levels? We mentioned a few, but yeah, tell us some of the actual species that you're measuring with your test.
So your four big red ones are they're your red complex pathogens, and so they're your big baddies, and they're the ones which they have the strongest association to severe gum disease. So you've got Agrobacter, or AA, because it's very difficult to pronounce, so I'm going to stick to AA. Tannerella forsythia, Treponema denticola, and Porphyromonas gingivalis. So those are your four big ones. If you see that in a microbiome test result and you see that the patient also has gum disease, then that means that you need to get rid of those bacteria. So we might put them on a course of antimicrobial mouthwashes. So I actually like mouthwash, but I prescribe it in a way that it's being used to, in a localized and personalized way for a patient to get rid of specific bacteria. So we maybe put them on a course of that for a few weeks. Sometimes if it's really severe, we'll give them antibiotics, but we know exactly which antibiotic to prescribe them because we know what bacteria is causing the disease. And then we might, once all the bad bacteria is out, we bring in good bacteria. So we start to repopulate with probiotics and prebiotics, so food for the good bacteria and the good bacteria. So that's like our main kind of our overall protocol. Which mouthwash and which probiotic and which prebiotic is kind of dependent on what bacteria is high. But those are your four baddies. Your strep mutans is for decay. So that's a very strong causative one. And actually, we see it a lot in patients who are mouth breathers too. So we see strep mutans in people who have a lot of decay, who might have poor oral hygiene, or they're breathing with their mouth open because their mouth is constantly being exposed to the external environment, and they're breathing in lots of things that they shouldn't really be breathing in. Yeah, I mean, I can keep going if you want.
Yeah, keep going. Yeah, it's
Okay.
interesting hearing that I know there's a big list, but no, it's good to hear kind of the different applications. Yeah.
So, Fusobacterium nucleatum is one which I would say is really for gum disease. Again, it's more of a, I'd say, chronic gum disease, but also that's the one which is associated with a lot of your infertility issues. So, it's a few nutritional recommendations actually can get rid of Fusobacterium quite easily. So, I don't do anything other than just give them some food and diet recommendations for that. We look for fungi as well, so Candida. Candida is a big one, which a lot of patients have. And if we see that, then if it's very low Candida, then we might actually give them again more of a natural antifungal. So grapefruit seed extract is fantastic. Just put it in your water a couple of times a day. And then obviously, if it's too high, we have to give them an antifungal. What else is the big ones? Porphyromonas gingivalis. I know I said it's for gum disease, but it's also one of the worst bacteria in the mouth because of its association with things like Alzheimer's, with, and mainly inflammation. So it's a very inflammatory bacteria. So if you have high levels of that, you probably have quite a lot of inflammation in your body too. Yeah.
Yeah, and as you said, there's 2 billion microbes in the mouth. We up to 700 species, and the diagnostic kind of the measurement of these species obviously gives a snapshot, but a powerful snapshot. But then it's also this whole kind of ecosystem that you explain you're trying to get back into balance through both targeted therapies, but then also to food and lifestyle change, which I think is a great way to kind of help people to understand that their overall lifestyle is really changing their dental health outcomes. Tell us a little bit about your views on kind of at home care for the oral microbiome. So, for instance, what you would generally tell patients for their toothpaste and mouthwashes and antimicrobials, which are on supermarket shelves. You mentioned prescription, which is obviously targeted for certain conditions. But what do you tell people about what they generally pick up at the supermarket?
So I would say a few kind of general rules to follow, because I don't like getting too specific because I see oral health products as kind of again very personal to the person. I think it's kind of like skincare where you should have like kind of, I don't want to complicate it, but like a morning and a night routine, and it might be that you use something different in the morning, and it's very different depending on what your needs are. So if you have a very acidic diet and you have a lot of erosion and you've lost all your enamel, you need a very different toothpaste to someone who has really bad gum disease or bad breath, or someone who has loads of decay needs a very different toothpaste to someone who has a caveman diet and has never had sugar in their life. So it's very dependent, but your kind of overall things to take with you to your supermarket when you're buying your new stuff is I would definitely recommend a toothpaste which is SLS free. That's sodium lauryl sulfate. Sodium lauryl sulfate is it's a foaming agent. So it's often used in shampoos and conditioners, but also toothpaste. It's what gives you that nice frothy feeling. However, unfortunately, sodium lauryl sulfate also can strip the natural kind of oils from the mucosa, and so it can actually be quite aggressive for the mouth. So no SLS. Otherwise, what else would I say? Mouthwash. So again, I would say ideally you shouldn't really need to be using a mouthwash. And if you do need to use one, it should be told by your dentist, and your dentist should tell you which one to use depending on what you need. But if you are really dying to, use your mouthwash, then I would say use it like a cologne or a perfume. It should be something that you use just to freshen your breath once in a while, but not in replacement for a toothpaste or your toothbrush. And if you do go ahead with that, make sure that your mouthwash is alcohol free, and has some sort of active ingredient in it. So I like CPC quite a lot. or I really like peroxyl. So it's basically hydrogen peroxide. So something like that, hydrogen peroxide, I like quite a lot. What else? Floss, obviously. Um, trying to think of like overall things that everyone can kind of take home. Toothbrush. I don't know about what you think, Stephen. I like a good electric toothbrush, pressure sensor. Um, Ideally, it times you 2 minutes. Um, yeah, I can't think of anything
Yeah.
else off the top of my head right now.
Yeah, no, that's a good summary. It's just, a good guide for walking down the super because there's a lot of things in there. So, things to watch with ingredients and so forth. Yeah, and there's obviously, but I like the idea of being specific because that's probably something that isn't so well communicated that, hey, we should actually know what's going on in the mouth before we go and throw something in there.
And I actually forgot one other thing with toothpaste, because you just reminded me there's so many new snazzy toothpaste on the market at the moment. So there's an age-old debate of fluoride or fluoride free, which I don't know what your opinion is, but if you're going for a fluoride free toothpaste, you need to make sure that it's got another remineralizing agent in it. And it's not just filled with essential oils. So what kind of annoys me is that there's a lot of these new toothpastes on the market and they're just filled with eucalyptus and peppermint oil and clove oil and all of this. And essential oils are actually really, really aggressive for the mucosa and they can strip the mucosa. If you think about it, you wouldn't put an essential oil on your hand. It can burn your hand. So why would you put it in your mouth? And if it's not going to have your fluoride, then you should try and find one that has hydroxyapatite. But even with the hydroxyapatite, you need to make sure that it's got the right particle size, it's been researched, because there are a lot on the market which just they have no regulations and they're not really approved yet. So just really do your homework, and make sure that it's the right type so that you're not going to get decay because you chose the wrong toothpaste.
Yeah, that's true for hydroxyapatite. A lot of the products out there you don't have a concentration even on the
No.
bottle, so you don't even know how much is in there or what type of particles. So it's a really good point. Whilst it's potentially a great agent, the regulation on the actual product itself is much less. So it's a great point for people to be aware of when choosing a toothpaste. So you mentioned dietary guidelines, and also to traditional diets, a little bit being kind of protective for decay. You're Iranian by birth, yeah? Is that correct? Yeah.
Yeah.
So and I've seen a little bit of you posting about your traditional foods and things. What do you see, like, or what do you recommend for people that are kind of going, towards food recommendations, and is there a tipping towards traditional foods for certain conditions?
Yeah, I think I have my mother is Iranian, and I've always been raised having Iranian food, and she's always taught me, this spice is good for that, that herb is good for this. Your stomach, you're a bit nauseous, have some mint in your water, and I grew up with turmeric and saffron in every meal, like it was just part of my day to day. And then recently, I've really been seeing that actually everything that has been taught to me has been stuff that is actually extremely beneficial for your health. And I think I'm not just Iranian, but actually a lot of the more traditional kind of health or superfoods that we see in, yes, Iranian culture, Chinese, and so many different cultures. A lot of people are starting to go back to those and rely on them, because I think so much food has now become so westernized, it's so super processed, that we're starting to see that actually having the most raw form of things, getting things really nice and simple is the best way to do it.
And if you say that you walk, put yourself in this situation, if you walked in, you were told you have gum disease, a little bit knowing about what you would kind of, how you would approach this now, what would you do? So what would you suggest someone that has been, told that they have gum disease, how would you suggest they go about it?
um, I think so. Okay, you should probably, ideally, I would like to say do a microbiome test, just so you know what bacteria is causing your gum disease and if you need antibiotics, which antibiotics to take. Then I would say in terms of food and supplements, so I would, sorry, going back one, blood test as well. So I quite like someone to do a blood test just to make sure, rule out any nutritional deficiencies. And it's not just that nutritional deficiencies could be causing the gum disease, but actually they could hold back you from healing well and from sorting out the gum disease. So ruling out any nutritional deficiencies for sure. And then you want to find yourself a good dentist or periodontist who would then be able to do treatment. I personally, and again, everyone's got their own protocols, but I like to do things in quite a short amount of time and quite intensely. So I like to do like these deep cleans over the course of 1 to 2 weeks and do everything within that 1 or 2 week threshold. My reason being is that if you've got, let's say you're doing half the mouth on one day and then, 2 months later you're doing the other half, then that bacteria from the dirty half is going to infect the healthy half. So ideally do it within 1 or 2 months of each other. 1 or 2 weeks of each other. And then it's really, really important how you take care of it at home. So I know dentists sound like a broken record, but interdental brushing and flossing is so important for particularly periodontal disease, because actually most of the bacteria starts to form between the teeth and cause the gum disease before it goes onto the surfaces. And then also one last thing I would say is what type of hygiene you have. So I don't know what you guys do over there, but I really like a hygiene called guided biofilm therapy. So we basically paint the teeth with a vegetable dye. It shows all the bacteria in the mouth, and it will really help you understand where you're missing when you're brushing. And for example, me, I always miss my lower left inside of my back molar. Like it's things like that which you don't really know unless you see it. And it will also help your dentist remove the bacteria properly because they can see it. Then they use like an antibacterial spray which has erythritol in it, so it's safe, it's natural. And then they'll go a little bit deeper with some vibrations and get rid of anything else. Supplements, I like coenzyme Q10. I think that really helps with oxidative stress and a lot of gum diseases to do with that, the stress on your body. Vitamin D, make sure that you don't have diabetes, check your blood glucose levels. And then also just kind of your all-round vitamins, so your D, your K2, your A, your C, which are all very important for healing quickly, and also preventing that gum disease from getting worse or coming back again.
It's a great summary in showing how overall health ultimately links to the rest of the mouth. Dan, look, we spoke a little bit of hydroxyapatite, but Dan's just asked, do you have a hydroxyapatite toothpaste or composition that you recommend, or?
Yeah, I'm quite annoying. I'm like the one who emails all of these companies, and I'm like, send me your research. I want to see this particle size of everything. So nano hydroxyapatite is the one. I really like one called Super Teeth. It's literally just super teeth. It's got a prebiotic in it. It's got CoQ10, and it's got the correct particle size of hydroxyapatite in it. And it's not the only one. There are others on the market, but that's one that I actually really enjoy. So that's in my nighttime routine.
Dr. Santa's nighttime routine. That's And so, look, it's painted, a real picture of how important, the dental health, is and can be in the future. So, I mean, just to sum up here, like, how would you say that you'd like to see this all move into the future? And like, what do you see that as big steps that we can take forward to bring this, so it's more available to more people?
I think that actually it's very patient driven. Personally, I think patients are the ones who want to take ownership of their health generally, and that's why we're all wearing our wearables, and we're obsessed with, how well we slept and what we're eating. And part of that will be also your oral health. And the only way to really understand your oral health, if you're not a dentist, is through numbers, through for example, saliva testing, so seeing what bacteria you have high levels of, what inflammatory markers you have high levels of. Everyone can read a blood test, so it's pretty similar, in my opinion. So I think that it's going to be very patient driven, and I think in terms of dentists, it is already becoming something that people are starting to see the benefits of. I think once we start to really strongly see improved patient outcomes from doing this more personalized approach, and this has to be evidence based. It has to be, multiple clinical trials at universities and academic institutions. Then I think a lot more dentists will be on board. It's not to say it's not correct right now, but unfortunately for dentistry, I don't know what you think, but things take a long time for people to start to adopt, and we're quite a stubborn bunch. We have been taught in a way, like as dentists, we're taught to do something in one way, and we do that way over and over and over and over again. And our work is very habitual. So when someone comes and tells us, hey, actually diagnose gum disease in a different way, I want you to treat everything completely differently, it takes a long time for that approach to be more mainstream. But I think it is getting there.
I think that's a great way to just describe it. And, also too on that is that, for dentists, we need things to be reliable too. So it's like we do kind of hang back on things that do work. So it makes sense as that way. But the other thing too is that there's good changes that can happen, and we need to embrace them as well. Dr. Sampson,
Yeah.
thank you so much for joining us, and then bringing all your great work and wisdom to light. And where can people find you, and what do you have on the horizon?
So yeah, you can find me on Instagram, Dr. Victoria Sampson. We have a clinic in Mayfair, London, called the Health Society. So it's in my bio, and that's where we do all of the testing that I was talking about, and all that treatment. In terms of on the horizon, there are a few projects kind of under wraps at the moment, so I can't exactly tell them yet. But I would say in the next few months, watch this space, because I've been working very hard on a few different projects. So yeah.
Excellent. Sounds very exciting. I'll be watching closely. Dr. Sampson, thank you so much for joining us today, and I hope to have a chat soon about the progression of the oral microbiome. And hope you have a good night there in the UK, and we'll talk soon.
Perfect. Thank you so much for having me.